Hi, thank you for visiting our website dedicated to helping individuals in podiatry malpractice cases. If you're here, you're wondering whether we can help you and whether you have a case for podiatry malpractice. Now, what we're going to do here is talk a little bit about what makes a good podiatry malpractice case and the types of cases that we ultimately accept in those individuals whom we can try to help. Now, one of the things we look for initially when somebody comes to us with a potential podiatry malpractice case is whether the doctor, the podiatrist, had sufficient clinical need to perform the surgery. Most times when people come to us, the podiatrist has performed some type of a surgery, whether that's a surgery to repair a hammer toe, a surgery to repair a bunion, or a fusion surgery, or some other surgery to the foot that apparently the podiatrist thought was necessary. Now, what we look for is indication in the podiatrist's notes or records that the surgery was actually necessary to begin with. And the way we do that is we look at what the clinical history is of the patient, whether they had a history of complaints, a history of more conservative treatment, and ultimately whether the podiatrist took the appropriate films or studies to determine whether that surgery was even necessary in the first place. What we often see is that there is a poor record keeping process at the podiatrist practice. And so we often see surgeries that have been performed without adequate foundation or without adequate films to support the surgery that ultimately took place. The second thing we look for is whether the surgery was appropriately performed. And one of the things that we often see is that when podiatrists go in to perform these procedures, they tell the patients that these are basic procedures, the recovery time is a week or maybe 2 weeks. And then they either perform the procedure too aggressively or make mistakes along the way. And the problem is that the bones in the foot are very small. And when those surgeries go wrong, they can lead to significant long-term problems. Another thing we look for is what happened post-surgery. Often patients come in following a surgery with complaints of significant pain. And a little bit of pain is normal post-surgery, but not long-term consistent pain. That's typically indicative of something having gone wrong. And what we see often is that podiatrists will ignore these problems or sort of dismiss these problems and tell the patient that they're just healing and everything will be fine. So we look at the records and we try to determine whether the post-operative care was appropriate. Finally, we also look at what the damages are. And the practical reality in these cases is that malpractice cases are complicated and they are expensive. So for us to even recommend to an individual that they consider pursuing a malpractice case, we have to see that there are significant or sufficient enough damages to justify the time and expense associated with pursuing the case. Often our clients have had multiple surgeries to revise or repair the damage caused by the initial surgery by the podiatrist. Often they have long-term difficulties in walking, in weight bearing, and in performing day-to-day activities. These surgeries, when they are done poorly, can be devastating. And those are the cases where we feel that we can really provide our services and help our clients to try to salvage something in the long term from this horrible situation that's happened. Often our clients come to us, and when they went to their initial podiatrist, they had a minor complaint. Maybe they had some rubbing in their shoe, maybe they had a minor discomfort. The podiatrist performs this surgery, and if it's not done right, it can lead to a lifetime of problems. Those are the kinds of people that we typically help. If you feel that you're one of them, please feel free to contact us, fill out the contact form on this page, or reach out to us today. These are the kind of cases that we handle, and these are the types of people that we help. Thank you.